Have you ever wondered what is PSD? It is short form for post-stroke depression. Yes, you're right. Not only stroke can affect your physiological, but can also affect your psychological. Hi, my name is Asmadina, and today we as a Group 1 will be explaining about stroke and its psychological effects. So strokes are actually a common medical condition that affects globally around 12.2 million stroke survivors. With the additional information, around 36% to 65% stroke survivors in Malaysia experience depression. So not only this affects the younger people, but it can also affect the older people that are facing enormous health, physical limitations, social, economic, and also emotional impacts. So now that I'm going to explain a tiny bit about what is PSD. A person can develop depression, anxiety, PTSD, PSD, and other psychological sequelae. But these clinical challenges are a bit undertreated and underrecognized. So in the US, Senator of Pennsylvania, John Fetterman, sought hospitalization for his PSD, and prior history of depression has brought into public's eye. So with this recognition, it improved our ability to help to prevent these difficulties for our stroke survivors. So now that you have a tiny bit of information about what is PSD, we're going to have a lot more other topics to be covered about what is PSD, the risk factors, psychological sequelae of stroke, managing PSD, the treatments, and our reflection as a group for PSD. Without further ado, let's jump into it.
Greetings, hi to listeners and also to everyone. So today I'm going to talk about my part, which is about article findings and about how today's topic is exactly related to psychology. So my name is Barbara Ali Matthew, so I'm going to explain to all of you about today's topic, which is about stroke. But my group and I, we specifically choose and detailed about stroke, which is about post-stroke depression. So before I started to go deeper into about today's topic, so I'm going to show all of you this picture. So what exactly is this? So this is brain. This is part of the brain. So how exactly the brain is related to stroke? So here it is. So stroke starts at the brain. Stroke, or aka brain attack, it happens when something begins to block blood supply to part of the brain, and when a blood vessel in the brain then bursts. In other cases, a part of the brain then became damaged or dead. A stroke is certainly caused, long-lasting brain damage or even long-term disability and death. PS is totally related to psychology because many people who have been having to face stroke ended up with physical limitations, cognitive and communication problems, and they also tend to develop depression, anxiety, PTSD, and other psychological sequelae. So depression is considered the most common and neuropsychiatric consequence of stroke. So first of all, we're going to dive into the assessment of PSD. So the assessment in person is a difficult task. It features some of the stroke, such as psychological, emotionalism, lethargy, and memory impairment, suggest that depression when they are the result of the neurological assault. Up to 45% of people suffered from stroke found to have mood disorder. So it is not an obvious that stroke also can cause mood disorder. So let's dive into next part, which is about the evaluation of psychological management of PSD. So there are two people here, Chambliss and Holland. In 1998, they concluded the conclusion that psychological treatment is empirically supported, requires that it has been subjected to randomized controlled trial, which statistically found to no treatment or to no alternative treatment. Treatments may be manuals, or logical equivalent, and reliable. In order to prove that psychological treatment is helping to people who are having stroke, they need to be more informative. Researchers need to have a clear definition about the population which treatments is designed and tested specifically for stroke and PSD. Yes, and they too should consider, identify treatments to address PSD in a person that having communication problems or cognitive deficits. But in the second article, it mentions about further psychological effects like depressions, anxiety, PTSD, mania, psychosis, irritability, and apathy. Lesion location. So lesion location. Researcher demonstrates that distance between brain lesion and frontal lobe plays an essential role in determining the severity of PSD. It happens between the left prefrontal lesions versus right hemisphere. In this research, it determines that people who have a stroke, their left hemisphere lesions have higher incidence and severity of PSD, meaning that if that person have a gap in their brain, which is especially in the left part of the brain, they mostly have a very severe PSD or post-stroke depression. Other psychological sequelae of stroke, other than depression, the other psychological sequelae are nothing but a burden to patients, families, and community. Anxiety and PTSD are two emotional consequences that often observed after the PSD. It's tend to present on specific phobia with or without associated with GAD. PSD and PTSD is clearly associated and tends to endure for longer periods when the conditions are occurring with each other. So, yeah.
Hi, I'm Clarice, and I'll be comparing between the two articles, which is the first one, Evaluation and Treatment of Psychological Effects of Stroke, and the second article, Psychological Management of Post-Stroke Depression. So the first article focused more on psychological effects, including depression, anxiety, and PTSD. Meanwhile, the second article specifically addresses post-stroke depression, PSD, and psychological interventions for managing it. Now, for the scope of the two articles, the first article covers evaluation, risk factors, and treatment options for various psychological effects. And then for the second article, it evaluates on the effectiveness of psychological interventions for post-stroke depression. Now, let's look on the statistics point of view. So, from the first article, approximately 1/3 of stroke survivors develop post-stroke depression. And the second one does not emphasize statistics, but critiques the lack of conclusive evidence for a single effective intervention. Next, the risk factors for the first article are genetic predisposition, age and sex, stroke severity, and lesion location. Meanwhile, the second article does not discuss any specific risk factors, but there are highlights barriers, which are cognitive impairments and communicational difficulties. So for treatment options from the first article, including pharmacological, for example SSRIs and SNRIs, and non-pharmacological, which are CBT and neuromodulation. And from the second article, they identify CBT as promising but notes the need for more careful research. For limitations, the first article does not critically assess the limitations of current interventions, while the second article highlights significant methodological limitation in existing research. Okay, so next, there are some recommendations from both articles. The first article emphasizes comprehensive evaluation and treatment to improve survivors' quality of life, and the second article calls for rigorous studies on diverse populations and improves research methodologies. And last but not least, we'll be talking about the conclusion for the comparison between these two articles. So from the first article, effective screening and treatment are crucial for enhancing stroke survivors' outcomes. And for the second article, more research is needed to establish effective interventions for post-stroke depression.
Hi, I'm Adani, and I will now guide you through the connection between the two articles on post-stroke depression. The first article provides a broad overview of stroke-related psychological effects like PSD, anxiety, and PTSD. The second article dives deeply into PSD, focusing specifically on psychological management. Together, they balance context and detail. The first article states that around 1/3 of stroke survivors develop PSD, offering consistent data. The second article highlights variability with the rates between 25 to 79%, showing the complexity of understanding PSD prevalence. Next, the first article identifies biological and environmental risk factors like genetics, lesion location, and aphasia. The second article focuses on barriers such as cognitive and communication challenges. The two perspectives combine to give a fuller picture of PSD's underlying risks. The first article, published in 2023, lists tools like PHQ-9 and HADS to aid diagnosis, addressing a gap noted in the second article, which was published much earlier in the year 2000, where it emphasizes tailoring assessments for patients but doesn't specify any tools. Multiple treatments are explored in the first article, from CBT and SSRIs to neuromodulation and mindfulness. The second article highlights CBT as promising but notes research gaps. Together, they broaden our understanding of PSD treatment. Both articles stress the need for better research. The first article focuses on personalized approaches for all psychological effects, whereas the second article calls for diverse studies specifically on PSD. They align in their call for improvement. To summarize, the first article builds on the foundation set by the second article. One focuses on PSD, while the other integrates it into a wider scope of stroke-related psychological issues, giving us a holistic understanding.
Hi everyone, I'm going to talk about stroke and how that is stroke related to psychological. Before doing the research, we already know that the stroke will affect the physical body, like face stroke pain, inability to move or feel on one side of the body, and having problem understanding and speaking. But after we doing the research, we know that stroke is not only influence physical, it also can influence mentally. The most common emotional issue following stroke is depression, and we call it as post-stroke depression. The psychological effect after stroke is not only depression, it also includes anxiety and PTSD. The post-stroke depression can cause by the biochemical changes in the brain. The people having stroke might disability to feel positive emotional after the brain injury. And another reason can cause post-stroke depression is physical disability, stroke severity, history of depression, and cognitive impairment.
Now that we have reached towards the end, we have a last look about what is PSD. So throughout the whole video, we can understand that it could impact our stroke survivors' well-being emotionally and mentally. So hospitals and clinics are offering behavioral health services and support groups for our stroke survivors. For example, like cognitive behavioral therapy and long-term support. So ongoing research are still vital to look into the PSD conditions to help preventing this. As the saying goes, prevention is better than cure, offering hope and better outcomes for all of the stroke survivors out there. And that's all from us. Thank you and goodbye.